In a move aimed at leveling the playing field in occupational recognition and support, the Castries Constituency Council (CCC) has begun implementing plans to provide medical insurance for its sanitation staff. The initiative, first announced earlier this year, is now taking root, marking a significant step towards prioritizing the well-being of frontline workers who often remain unseen and underappreciated. In an exclusive interview with our Choice News team, Castries Mayor Her Worship Geraldine Lendo-Gabriel shed light on the motivation behind this progressive policy.
One of the things that we realize is that working in the area of sanitation could be very hazardous to one's health. And there are certain stresses, certain challenges that persons who are engaged in that go through. As such, we saw the importance of ensuring that every staff of the organization has access to a medical health insurance. This is paid through 100% by the council for every staff member.
Mayor Lendo-Gabriel says the need for prioritizing healthcare for its workers is not a privilege, but a necessity, one that the Castries Constituency Council is determined to ensure for its staff.
The whole thinking is that when you are working in that field, whether you are directly involved or not, it requires that you take care of your health. Not naturally, persons must take care of their health, but there's an added need for you to pay attention to your health and safety, and as such, we have ensured that every staff member has that benefit afforded to them.
The mayor also shared that the initiative has been met with overwhelming positivity. Staff members are already capitalizing on the opportunity with a noticeable uptick in doctor visits and health consultations. Additionally, she noted that healthcare professionals have been invited to CCC to conduct sessions educating staff on the benefits of medical insurance and overall health awareness.
One of the things that we would have seen is that the extent to which persons visit the doctor increased over time because they became even more aware. And last month in particular, we also worked with those persons, the providers of that service, to come in and refresh the staff about the medical insurance, its benefit to them, how can it be utilized, and the whole procedures in relation to that.
But how can a healthy complement of staff equate to a productive workforce?
It means for us as the employer that our staff would not stay away from work for a very long time without the necessary going in there to get the necessary checkups, not both on a preventative basis as well as when you are actually going through in terms of a curative basis. So the insurance is both preventative in nature because in addition to having the medical insurance, we give staff what we call an annual checkup. So staff go out and get the annual checkup, and that is preventative. And the curative one would be when they're actually going through a particular medical issue, medical challenge, they can get to the doctor. They do not stay for a very long time before finding out what it is and treating it in a timely manner. So the timeliness of them treating ailments would also increase or improve.
This move by the CCC sets a compelling precedent for valuing all contributions to society, especially those whose hard work is often taken for granted. For Choice News Now, I am Kishana Smith.